Bonjour, buen dia, good afternoon, and welcome everyone to the ICN International Nurses Day webinar. Firstly, let me offer greetings and congratulations to everyone on this International Nurses Day 2026, and we're going to be sharing with you our new report and our theme for this year: Our Nurses, Our Future, Empowered Nurses Save Lives. Before we start, just the practicalities, of course. There is full translation, simultaneous translation in French and in Spanish. Just use the interpretation icon at the bottom of your screens and select your language, please. Do use the chat function to send your greetings, to say hello, to let us know where from around the world that you are joining us. And if you have questions, please use the Q&A tab. Can't promise that we will answer all of the questions in the session, but we will come back to you and answer any of the questions that you raise. So firstly, colleagues, let's start by sharing with you a short animation that explains and gives an overview of this year's IND report and our theme: Empowered Nurses Save Lives. Play VT, please. So, colleagues, this is a day to celebrate nurses right the way around the world, to thank nurses from right the way around the world. I can see you joining us from Ireland, from Mexico, from Germany, from Spain, from Chile, from Colombia, from Canada, from Turkey. It goes on, and it's great to have so many of you from right the way around the world. But this is a day where we also want to focus on nurses and nursing power. And what more fitting way then to start our webinar with a message from one of the most powerful nursing leaders globally, our president, Dr. Jose Luis Cobos Serrano.
Hello, dear colleagues, dear friends. It's a great honor to welcome you all this special International Nurses Day webinar. Let me begin by thanking our national nursing associations for their leadership and for bringing us together today, and to each of you joining from wherever you are in the world. Today, we come together as one global nursing family. On this International Nurses Day, I want to extend my deepest congratulations and gratitude to the world's 30 million nurses for your commitment, for your leadership, for your passion, and for the care you provide every single day. In every country, in every city, nurses are making a difference, saving lives, supporting communities, and strengthening health systems. You are the backbone of care and the heart of health. This year's theme, Our Nurses, Our Future, Empowering Nurses Save Lives, is both a celebration and a call to action. It recognizes a simple truth. When nurses are empowered, health improves, systems are stronger, and societies thrive. This message is at the center of our International Nursing Day report this year. The evidence is clear. Nursing power is real, it's measurable, and it's transformative. As the largest and most trusted part of the health workforce, nurses are closest the people and communities. You are uniquely positioned to deliver the person-centered, accessible, and high-quality care that the world urgently needs. But we must also be honest about the challenges we face. Across the world, nurses are working under extraordinary pressure, facing workforce shortages, increased demand, limited resources, and too often unsafe or unfair working conditions. And in many parts of the world, nurses are delivering care in situations of conflict and crisis. Through our campaign Nurses for Peace initiative, ICN is calling for peace, for the protection of health workers and health facilities, and for respect for international humanitarian law. Nurses are witnesses to the human cause of conflict and also powerful advocates for peace. Your voice matters in calling for dialogue, dignity, and the protection of life. Without urgent action, we will not achieve universal health coverage or the Sustainable Development Goals. This is why my presidential watchword is empowerment, because empowering and empowered nurses are not optional but essential. Empowerment Empowerment means safe and fair working conditions. It means the ability to practice to the full extent of your education and skills. It means having a strong voice in leadership and decision making at every level. And it also means something more. It means that we, as nurses, must raise our collective voice. We must advocate. We must speak to governments, to policymakers, and to the society. We must ensure that nursing is valued, protected, respected, and invested in. Because we are not only caregivers, we are leaders, we are innovators, and we are change makers. And together, our voice is powerful. Investing in nursing is not a cost, it's a high return investment that saves lives, strengthens health systems, and supports economic and social development. So today, as we celebrate International Nurses Day, let us also recommit to supporting one another, to strengthening our profession, and to using our voice not only for health, but for humanity and for peace. Thank you for everything you do, and I wish you all a very happy International Nurses Day. Thank you very much.
Gracias, Presidenta Cobos Serrano, for such a powerful message and for your impactful leadership as well. Colleagues, let me just set a little context as to why we chose the theme Empowered Nurses Save Lives for this year's International Nursing Day. On the screen, you can see a summary of the current global health agenda, the challenges that we are facing right the way around the world. NCDs are the biggest killer of people globally. We know that half the people of the world don't have access to fundamental health care. We're aging, super aging in some places of the world. We have growing mental health needs and demands, real urgency around improving public health, recovering immunization rates. And sadly, we know that humanitarian crises as the result of disasters or conflicts are increasing as well. You will have heard ICN say before that when we look at this global health agenda, what we see is a nursing agenda. We cannot address these health issues. We cannot make progress on improving global health without the global nursing workforce. But then if we look at the state of the world's nursing, you'll remember, I'm sure it's 1 year ago to the day that with WHO, we published the second State of the World's Nursing report. And that report contained some positive developments, but also some challenges. We've grown to nearly 30 million strong, the largest of the health professionals, making up 50 to 60% of health workforces right the way around the world. But we still have a shortage of 5.8 million. That's only down just a little bit, the 6 million back in 2020. We know that there are real issues with nurses not being valued, protected, and respected at work. We have a significant unequal distribution of nurses right the way around the world. And whilst we have seen positive progress in nursing leadership positions, CNO positions, up to 85%. We know that there are differences between high-income countries, low-income countries, and also differences in the pipeline of next generation leaders. training and development and leadership development are not universally accessible to today's nurses who will be tomorrow's leaders. And we know from a major survey just over a year ago of our national nursing associations that they described a widening gap between demands for healthcare continuing to rise, but challenges and reductions or standstill in the supply of the nursing workforce. But what we also see from around the world at ICN is the response that nurses are leading to the health challenges that we face. Whether it was leading us through the pandemic, whether it's responding to crisis and disasters, whether it's increasing access to universal healthcare, whether it's addressing mental health needs, nurses are at the forefront of that response. Next slide, please. But whilst we see this incredible nursing response to those health challenges, often you'll be familiar with the language that people use to talk about nurses is their care, our compassion, our kindness. That is, of course, true. Care, compassion, and kindness are foundational to the work, the practice, the ethos, the philosophy of nurses. But what's clear is that nurses are bringing many other powers to address global health needs. And what we are seeking to do on this International Nurses Day is to frame nursing in a different way, to set out a new model of nursing powers, to move from a unidimensional or a monochrome view of the nursing profession to a multi-dimensional, a multicolored reality, reflection of the reality of what modern day nursing is about. And you can see on the screen here, we describe 7 powers of nursing, from the power of trust. We talk often about how nurses are always at the top of surveys of the most trusted professions. But in this world of misinformation, where people are struggling to get accurate health information, that is a real power that we have. We know we have the evidence of how what nurses do matters to patient safety, infection prevention and control, trips and falls, and medication errors. Our very size means that we can reach those difficult, rural, urban, hard to reach places, often being the only health professional that people and the public can and do connect with. We've presented before, colleagues, that we have economic power. The work that nurses do saves money and contributes to economic growth and prosperity because we keep people well and healthy and able to contribute. And what we have seen most vividly in recent months is the power of nursing in conflict zones to not only bring healing and health, but through that work to support peace building and peacemaking as well. The report, you can see the cover. Use the QR codes to scan and download. All of the resources are available on the website. Colleagues, I want to introduce you now to the 2 people who have absolutely been key to authoring and producing this new report. David Stewart, our Director of Nursing, and Gillian Moore as well. This has been a labour of love for them. But I believe that they have produced a new way for us to think about and talk about nursing as well. So it is my very great pleasure to hand over to Gillian and firstly to David, but to hand over with very sincere thanks from everybody to both of you for your work in bringing us this gift of a report. David, to you.
Yeah, thank you very much, Howard. And let me add my welcome and happy International Nurses Day to everyone online. If you were sitting at the board table today and you were asked the question, what should we invest in to protect health outcomes over the next decade? nursing should be on that short list. But investment only occurs if it lands performance. And these 7 powers are our answer to that. They define the capabilities leaders must secure to really get those measurable returns. Trusted care, safe professional practice, enough workforce capacity, full scope of delivery, high quality daily care, real community reach, and protected health services in crisis. So empowered nurses save lives. It's a real leadership agenda. It's about removing constraints. It's about funding what works. And it's about holding accountable to the outcomes that really matter. And so I'm going to focus on 4 before I hand over to Gillian. And those are, first off, the power of trust. For 21 years or more, nurses have been at the top of the professions that are most trusted. And this is globally. It's a global phenomenon. And this, I think, comes because of the strong history that we've had and a strong legacy of a profession. But it is an important clinical asset because it drives uptake, it improves adherence and disclosure, and also public cooperation, particularly in times of crises or in misinformation environments. There's one point that really makes this clear. People who feel that their primary care professional spends enough time with them are about 30% more likely to actually trust the health system. So trust is not just nice, it's actually a really important clinical resource. And it has direct impact on adherence to treatment, such as medications, vaccine uptake, and also disclosure of that relevant information, particularly when patients are at their most vulnerable period of time. And nurses are that most credible interface. And a good example of this is the importance of nursing in public health measures such as immunization, which has saved approximately 150 million lives over the past 50 years. But if we are to hold on to this trust, we must also protect the conditions that have created it. Time with people, safe staffing, and a culture of safety, respect, professionalism, and ethics. I want to move on quickly to the power of the professional because they're so intrinsically linked. Because the professional is that set of guardrails that keeps people safe and as systems change. And this is underpinned by education, ethics, standards, and regulation. But here's the blunt truth. Skill is not interchangeable, and cheap capacity is dangerously expensive. Research shows that every 10% increase in bachelor-prepared nurses reduces patient deaths by about 7%. That is professionalism translating directly into survival. And if we really want to keep patients safe, then professional foundations are how we prevent risk from being pushed onto patients. But also the power of numbers. Numbers is about capacity and coverage. Without enough nurses, it means that services are often inaccessible or that ration of health services may be required. And this occurs through things such as delayed care, missed care, or avoidable deterioration. So whilst the world has about 30 million nurses, this shortfall is significant. But if we could just address it, addressing that shortfall, there are huge positive gains to be made. Approximately 190 million life years lost and adding about $1.1 trillion to the global economy. So retention's got to be a core strategy of this because we can't just keep building a pipeline that is large enough to fill the vacancies that are being kept. And we also must look at ethical recruitment. Lastly, for my section, the power of practice. This is really about being a productivity lever because full scope and advanced practice makes sure that patients can access timely care and that clinical time is spent wisely. The OECD recently conducted a study and they found that about 80% of nurses report being overskilled for their day-to-day roles. That is wasted capability at scale. And evidence shows the direction of travel. About 80% of preventative care and about 50% of chronic care could be delivered by nurses when systems enable it. And so the implications are really straightforward. We need modernized legislation. We need to build credible career pathways and align nurse-led models. And we're not just about headcount, but also about efficiency. I'm going to pass on to my colleague Gillian, who will also go on to some of the other powers.
So thanks, Dave, and wishing everyone a very happy International Nurses Day as well. So I'll briefly walk through the rest of our 7 powers, and starting with the power of care, which is all about nurses' huge impact, really as the beating heart of primary person-centered healthcare. We know that to cope with all of the growing health demands that Howard and Dave have been discussing, from aging populations to chronic diseases, health systems must transform towards care that's preventive, care that's designed around individuals, around people, that helps people to stay well, that helps them to manage and to prevent chronic conditions. And all the evidence in our report shows that nurses are making a huge impact by treating the whole person in their full social context across their whole lifespan and in every setting imaginable. And the data shows that scaling up this kind of primary healthcare could save 60 million lives by 2030. And that's in low and middle income countries alone. So empowering nursing care really does save lives and transform health systems. And then moving to the power of proximity, this is really the power of nurses being the health professionals who are really the closest to patients and to communities. A huge power when we know, as Dave said, that so many people still struggle to access healthcare. And this power is about nurses being where people are. They're physically close, they reach so many settings, they bring care to marginalized and to underserved communities, they advance universal health coverage, and we have incredible case studies in the report telling amazing stories of nurses reaching really hard to reach regions, including riding horseback across remote terrain in some cases, all to make sure that all people have access to care. And the data also shows that this proximity, that nurses' closeness to patients and their close relationships to patients, let them notice changes early, let them respond quickly, let them anticipate and prevent errors. And that really protects patient safety and prevents harm. And preventing that patient harm saves lives, and it saves hundreds of billions of dollars in health system costs as well. So we really do need to empower nurses' ability to be close, to continue to reach people in this way, and to have protected time building those trusted relationships with patients and with whole communities. And then our final power is an incredibly important power, the power of peace. And this is so important and urgent because every day in conflict and crisis settings, we see that without a doubt, nurses are peacemakers as well as health makers. Nurses right the way around the world are protecting the right to health, they're defending human rights, they're keeping health systems going, they're providing healing as well as hope, and they're protecting global health security, they're protecting against epidemics in unthinkable crisis and conflict situations. But we also know that all too often nurses are risking their own lives to bring this care. We're seeing rising attacks on healthcare, the highest number of attacks ever recorded in 2024. And ICN's message and work has been really clear that this cannot be normalized, that no nurse should ever be a target. And ICN's Nurses for Peace campaign directly supports and advocates for nurses in conflict settings because nurses need to be protected and empowered. Empowered nurses support care, they support communities, they save lives, and they support peace. So these 7 powers all taken together are the hard powers of an extraordinary profession with a huge and measurable impact, saving lives, improving lives, strengthening health systems, and improving every health outcome that there is. And the report proves this, not only with the data, with the evidence, but also with lots of case studies, with real life stories of nurses on the ground using these powers every single day. And running the whole way through this year's IND report is the economic power of nursing. We have strong data showing that investing in health brings major returns. For every single dollar that's invested, you get at least $2 to $4 back, sometimes up to 14-fold returns. And strengthening the health workforce, with nurses, of course, is the biggest part of that workforce, could add over $1 trillion to our global economy by 2030. And that all supports ICN's long-standing message that nursing is not a cost to be managed. It's a high return investment. Investing in nursing means investing in gender equity, investing in health for all, investing in populations right the way around the world, and investing in impact. And finally, we'll hear a bit more later on this too, but the report also sets out the roadmap for where to invest, from fair pay and working conditions to full scope of practice, safety, protection, nurse leadership, and education. So it's really making a strong case to structurally empower nurses to save lives. And I'll pass back over to Howard.
Thank you so much, David, and thank you so much, Gillian, as well, for your work and so clearly setting out the hard powers of the nursing profession and the evidence to support that. Colleagues, I think that we have a little bit of a special treat right now in terms of a very special guest who joined us this morning, who has been on endless webinars today already. Amelia, it is very, very good to see you again. Colleagues, when we are talking about nursing power, we of course have to hear from one of the most powerful nursing global leaders, our Chief Nursing Officer at WHO, Dr. Amelia Latu Afuamango Tui Palutu. Amelia, thank you so much for finding the time to join us twice today already. You're very, very welcome, and please do say a few words.
Happy International Nurses Day. Today we celebrate nurses everywhere. Our nurses, our future. Empowered nurses save lives. To every nurse, future leaders across the globe, thank you. Your courage, compassion, and commitment inspire us. We stand with you and celebrate you today and every day as you continue to build stronger, fairer, and more resilient health systems that serve everyone, everywhere. Thank you, CEO Howard Caton. I am and will always be proud to be a nurse. Merci beaucoup.
Amelia, thank you so much for joining us. And on behalf of us all, let us say a heartfelt thanks for all that you do at WHO, the WHO Academy now as well, to support and strengthen the nursing profession. We know that recent months have been challenging in terms of global health. We stand with you, but we recognise the work and the commitment and your leadership, and we thank you for that. And also, Amelia, you will know this, but to share with other colleagues, I saw on social media a very nice message and video from the Director General, from Dr. Tedros, again reaffirming his commitment to the global nursing profession. I couldn't help myself but respond to him. But to say that I just think it is his leadership and your leadership is so important in terms of the example that it sets to countries and health leaders right the way around the world. When you and Dr. Tedros are talking about the power of nursing, that helps our associations, it helps nurses and nursing leaders on the ground enormously to encourage their health leaders to make changes as well. Thank you, Amelia. The next slide, please. So, colleagues, where we've reached now is that you have heard about the seven powers. You have had the data and the evidence to inform and support those powers that we are setting out. But as we all know, this is not something we're imagining or wishing would happen in the future. This reflects the reality of what nurses are doing right the way around the world today. And your stories, your case studies, your examples of how you are using your powers are also incredibly, incredibly important. And we wanted to provide the opportunity for some of our associations to share a little bit more today about the powers that they are using in their country, in their region, to support, to strengthen the nursing workforce. So firstly, from Colombia, please let me introduce Esperanza Correa, who is the General Secretary of the National Association of Nurses in Colombia. Esperanza, thank you for joining us, and the floor is yours.
Good morning, everyone. It is a pleasure for us as a collective of nurses to be here with you. I'm going to talk about the Power of Peace. Our National Association of Colombian Nurses works to transform society in order to value health and life as a fundamental right. And we have a social commitment to work towards those goals in coordination with the current government, which is trying to achieve a new social contract in order to overcome exclusion. It fights for non-repetition of conflicts and seeks to transform our society in order to promote harmony with nature and peace. To that end, as Colombian nurses, we have participated actively in many debates, public debates, with regards to the reform to the health system, looking for a better primary care system that is more responsible and more organized. We are present in over 10,800 health units of our 32 departments in the country in order to facilitate access to comprehensive health care, trying to strengthen early identification of risks and providing a fast response to crisis. This is helping us to achieve the goals of the country, of the government of our country, to reduce poverty. And the reduction of poverty is very linked to healthcare. And care is a very important subject for nurses and also for women in our communities, because we are trying to safeguard these interests for the entire society in Colombia. Thank you very much.
Muchas gracias, Esperanza. A fantastic intervention demonstrating how connected nurses are to issues of peace, conflict, but also the sustainable development goals, and how this work is also incredibly important to address gender inequalities and advance women's empowerment as well. Colleagues, next let me introduce Ayan Dahir, who is a member of our Student and Early Career Nurses Alliance. Ayan is from the Somaliland Nursing and Midwifery Association. Ayan, we are delighted to have you with us, and please, the floor is yours.
Thank you. Hello, everyone. Good morning, good evening, and good afternoon. My name is Ayan Dahir. I'm second-year nursing student at Hargeisa School of Health Science. I'm honored to have been selected to represent Somaliland as a young nurse leader. Today, I would like to say a few words about the power of peace in Somaliland. Peace is one of the most valuable things a society can have. It allows people to live safely, study freely, work hard, and achieve their dreams. In Somaliland, peace has played a very important role in building communities, improving education, and developing health service. So the power of peace is not only the absence of conflict, but also the presence of unity, respect, cooperation, and understanding among people. This creates opportunity for growth and development. It helps community become strong and healthier. As a nursing and health student, we understand the importance of peace in healthcare. A peaceful society allows hospital and clinicals to function properly and helps healthcare professionals provide quality care to patients. Nurses also contribute to peace by showing compassion, kindness, patience, and equal care to every individual regardless of their background. So young people also have an important responsibility in protecting peace through education, positive communication, and teamwork. We can help people a bright future for our communities and our country. So in conclusion, peace is a power because it gives people hope, stability, and chance to succeed. Let us continue to value peace, protect it, and work together to create healthier and strong Somaliland. Thank you. Happy International Nurse Day.
Ayan, thank you so much for your intervention. Thank you for also representing the voices of student and early career nurses. And I am struck by the conversations that I have with student and early career nurses. One of your real powers as well, I believe, is in relation to new technologies, AI as well. You are embracing and seeing the potential for how those technologies can support and strengthen nursing for the future. Colleagues, you have heard a number of references already to nurses' power in relation to peace building and peace making. ICN established our Nurses for Peace initiative 4 years ago now. We're currently working to support nurses and nursing associations in 10 different countries around the world. And just in recent weeks, we have been in very close contact with our nursing leaders and nursing associations across the EMRO and Gulf region. Our board member for that region, Myrna Dumont, has been working tirelessly to coordinate, to stay in contact, and to support nurses and nurse leaders in that region. And given everything else that's been going on, it's incredible that they have been able also to produce this special additional report for this year's International Nurses Day. And I'm going to hand over now to Myrna to tell you more about the work that they've been doing and the experiences in their region. Myrna, the floor is yours.
Yeah, thank you very much, Howard, for this presentation, and good morning, good afternoon, good evening to everyone. Distinguished leaders, respected colleagues, and courageous nurses across the world, and specifically the EMRO region, happy International Nurses Day. Today, we gather as one nursing family across the 22 countries and territories of the Eastern Mediterranean region. serving nearly 745 million people across one of the most diverse and resilient regions in the world. Ours is a region that has endured wars, humanitarian crises, pandemics, displacement, disasters, and economic hardship. Today, more than 140 million people in our region require humanitarian assistance, and millions continue to face instability and suffering. Yet, despite all these challenges, nurses remain at the center of hope, healing, and humanity. Today, on International Nurses Day, we proudly stand together around this year's powerful theme: Empowered Nurses Save Lives. Our nurses, our future. This is not merely a slogan, it's the lived reality of nurses throughout our region. When health systems are overwhelmed, nurses remain standing. When fear enters hospital and homes, nurses bring reassurance. When conflict divides people, nurses protect dignity and humanity. And when lives are at risk, nurses are the ones who stay. This is why empowering nurses is no longer optional. It's a necessity for the survival and advancement of our healthcare systems and societies. Empowered nurses save lives because nurses possess seven powerful strengths that we have seen and that our colleagues at ICN presented. The power of trust, because people trust nurses with their pain, fears, and lives. The power of the profession, because nursing is built on science, leadership, knowledge, and excellence. The power of numbers, because nurses are the largest and most influential healthcare workforce in the world. The power of practice, because nurses deliver expert care and make life-saving decisions every day. The power of care, because compassion and humanity remain the heart of healing. The power of proximity, because nurses are closest to patients, to families, communities, and understand their true needs. And the power of peace, because nurses heal beyond borders, beyond conflicts and differences, bringing hope and humanity wherever they serve. These are not abstract concepts. These are powers demonstrated daily by nurses across the Emro region, in hospitals, refugee camps, rural villages, schools, ICUs, and communities affected by conflict and hardship. But let us be very clear. Nurses cannot continue carrying the weight of healthcare systems without support, protection, and empowerment. To healthcare leaders and policymakers, if you want stronger health systems, invest in nurses. If you want safer patient care, empower nurses. If you want resilient societies prepared for future crises, lead with nurses. Empowerment means more than praise and words. Empowerment is action. It means quality education, safe workplaces, fair policies and decent working conditions, and leadership opportunities. It also means investing in nurses' mental health and well-being. And it means ensuring that nurses are represented wherever healthcare decisions are made. And to every nurse colleague listening today, never underestimate your value or your voice. You are not simply supporting healthcare, you are sustaining it. You are not only witnesses to history, you are shaping the future. In the era of artificial intelligence and digital transformation, the world may change rapidly, but one thing will always remain true. Healthcare will always need the human connection, ethical judgment, compassion, and presence that only nurses can provide. Dear nurses, you are the heartbeat of healthcare. You are the strength of our communities. You are the guardians of humanity during crisis, and you are the future. Today, let us move beyond recognition towards transformation. Let us unite across all 22 countries and territories of the EMRO region to build a future where every nurse is empowered to lead, innovate, influence policy, and transform healthcare. Because when nurses are empowered, lives are saved, communities become stronger, health systems become resilient, and nations move toward peace, dignity, and hope. Having said that, I'm proud and delighted to introduce the EMRO e-Journal, a collaborative achievement by the national nursing associations across our region, created for the whole world to witness and appreciate the outstanding work being done for nurses and by nurses and for healthcare advancement throughout the EMRO region. This e-journal reflects the strength, innovation, resilience, and leadership of our nursing community. It showcases the remarkable efforts, initiatives, achievements, and contributions of our national nursing associations in empowering nurses and strengthening healthcare systems across the region. I would like to extend my sincere appreciation and gratitude to all the NNAs that contributed to this edition of the e-journal. Your dedication, collaboration, and commitment made this important initiative possible. To those NNAs who were not able to participate this time, we warmly look forward to future contributions and collaboration in upcoming editions, because this platform belongs to all of us. I would like also to express special thanks to the Emirati Nursing Association for taking the lead in developing and creating the platform for this e-journal. This achievement is a true example of what can happen when we all collaborate, all unite our effort, and work together with a shared vision for nursing in our region. And finally, our sincere gratitude to the ICN for its continued support, partnership, and commitment to advancing and empowering nurses worldwide. This e-journal is more than a publication, dear colleagues. It's the voice of our region. It's the story of our nurses. And it's a reflection of the power of collaboration, unity, and shared purpose. And I invite all nurses to read it and send us their feedback. And now, it gives me great pleasure to introduce a dear colleague, the President of the Order of Nurses in Lebanon, Mrs. Abir Kurdi Alemi. Abir's dedication, leadership, and continuous commitment to advancing the nursing profession and supporting nurses across Lebanon are truly commendable. And she will be talking about the forces of power. The floor is yours, Abir.
Thank you, Dr. Mirna, and thank you, ICN, for the opportunity, and thank you for all the nurses all over the world. I'll be talking about the power of peace. The power of peace, which is far more than the absence of conflict. It's the foundation for protecting health, preserving dignity, sustaining healthcare systems, and enabling communities to recover and thrive. The lessons learned from the multiple crises Lebanon has faced demonstrated that peace is essential for nurses to safely provide quality care and fulfill their professional, humanitarian, and public health roles. During periods of conflicts, displacement, economic collapse, and insecurity, Lebanese nurses remained on the front lines despite immense physical, emotional, and psychological pressures. They continued caring for patients in hospitals, emergency departments, and primary healthcare centers, supporting displaced population and responding to urgent humanitarian needs. Nurses played a critical role not only in saving lives, but also in preventing disease outbreaks through carrying out and leading vaccination campaigns, health education, and continuity of essential healthcare services. Their presence was vital in emergency response, crisis management, and maintaining the resilience of healthcare services during extremely challenging situations. This experience demonstrated that peace is what allows nurses to move from survival mode to effective, compassionate, safe, and high-quality healthcare delivery, to focus on prevention, health promotion, patient safety, and long-term community well-being, rather than only emergency survival interventions. The crisis also highlighted the importance of preparedness, mental health support, and strong coordination mechanisms. The Order of Nurses in Lebanon worked closely with ministries, humanitarian organizations, healthcare institutions, and nursing leaders to support the continuity of care advocate for the protection of healthcare workers, and remain connected with the displaced nurses themselves to access and respond to their needs. Various trainings, mass casualty management, emergency preparedness, pediatric trauma care, blast injury management, and mental health support further strengthen the nurses' readiness, resilience, and capacity to respond rapidly and effectively. Continuous solidarity and support from the ICN, WHO, and the nursing associations across the AMRO region reinforce the importance of international cooperation, professional solidarity, and collective advocacy for nurses working in crisis settings. As reflected in the ICN 7 Powers Framework, peace empowers nurses not only to heal, but also to lead, educate, advocate, innovate, prevent epidemics, strengthen health systems, and rebuild communities. Nurses are essential actors in recovery efforts, social cohesion, and restoring stability after crisis and conflicts. Ultimately, the Lebanese experience taught us that investing in peace is an investment in nurses, in healthcare systems, public health protection, economic recovery, social stability, and the future resilience of countries like my beloved Lebanon and its people. Happy Nurses Day. Empowering them really saves lives. Thank you.
Thank you, Adil. And now it gives me the honor to introduce another colleague from the region, Dr. Sumaya Al-Balushi, President of the Emirati Nursing Association. Sumaya's remarkable leadership and dedication to advancing nursing practice and regional collaboration continue to make a significant impact on the nursing profession across the region. Thank you, Sumaya, for all what you are doing, and the floor is yours. You unmuted, Sumaya. Sumaya, unmute. 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 Okay.
Good afternoon, everyone. Thank you very much, President Jose. Thank you very much, Howard. Thank you, Dr. Mirna, for the great having the celebration for International Nurses Day. It's really not only a celebration for a profession, but we are celebrating for the heart of our health system on this planet. And this year's theme, our nurses, our future empowered nurses saved life. It's not simply an inspiring phrase. It is actually a call to action for me. The ICN's report makes it clear that whenever we empower nurses, the power of empowering is meaning a safe working environment, fair pay, full practice authority, and real leadership. They don't just improve care in this case, but actually they are going to transform health system and save lives at scale. But empowerment cannot be a word we use it without commitment behind it. It means governments must invest, health institutions must act, and we as nursing leaders must demand the seat at the table that this profession deserves. In our country, with Emirates Nursing Association, we have seen the first-hand what empowered nursing looks like when nurses lead, when they are supported, when their voices are heard in policy, the outcomes speak for themselves. Today, I want to give my message to every nurse watching is simple. You are not just caregivers. You are change makers. Your knowledge, your leadership, your daily courage. These are the forces that advance equity, strengthen our communities, and build the healthier world we all need. Thank you very much, ICN, to our global nursing family. Let us leave today not just inspired, but committed. Because to me, commitment is the most important than just empowering ourselves once in a while. Because empowered nurses don't just save the lives, but actually they shape the future. Thank you very much for listening to me.
Thank you, Dr. Sumaya. Thank you, Mrs. Abir, for your insightful presentations. And I'm sure that with leaders like you in our region, our nurses would do the impossible. Thank you, ICN. And we cannot conclude this small section about our e-journal, EMRO e-journal, without thanking Her Highness Princess Muna Al Hussein, our patron, the patron of our region, and for her support, continuous support, encouragement, and whenever we ask her presence and her intervention, she's always here for us. Thank you very much. And now the floor is yours, Howard.
Myrna, thank you so much. Myrna, Abir, Samaya, so very good to see you. Thank you for such powerful interventions, but also I think inspirational interventions, and for finding the time to bring us this special report from the EMRO region. Colleagues, you can see the QR code on the screen. You can scan that to download it. But this report, along with our International Nurses Day report, is available on the website as well for you all. Myrna, thank you so much for mentioning Princess Muna as well, your regional ambassador. She's also the ICN Global Ambassador for Nursing as well. She has joined us at the last 3 congresses and more before then, I know, as well, has been an incredible advocate for the nursing profession. And colleagues, I just wanted to share one other thing about the importance of telling stories, of sharing with others what you do in practice and the case studies. This morning on our webinar, we were joined by an executive from the BBC. You will know that we have had a project with the BBC called Caring with Courage, 2 series of films, short films of nurses from right the way around the world. The executive who joined us this morning shared with us that 250 million people have engaged with the films that we have made with the BBC. That's an incredible number and reach. And the BBC said to us that what was particularly impressive is not just the number, but people stay and watch the films. They want to engage, they want to learn, and they want to listen more. So putting our powers together with the evidence, but your stories, you must own and talk about your powers and share that. Don't let others speak on your behalf. It's incredibly powerful for the advocacy that we all do to try and advance the nursing profession. So, colleagues, you've heard what we are offering in terms of the report, the data, and the evidence. But of course, you're all part of the global family, and we have some work for you to do as well. And I am now going to, with very, very great pleasure, pass over to the ICN First Vice President, Sineva Ribeiro. Many of us would love to be able to say that we've got 1 or 2 of the powers that we're describing today. Sineva, I think you have them all over your distinguished career, and your support now with ICN. I know that you have examples of having worked in relation to, I think, all of those seven powers. So we're very honoured to have you as our first Vice President, and the floor is yours to give our call to action.
Thank you, Howard. Thank you so very much, and all colleagues over the world. Happy Nurses Day, International Nurses Day is to us. Congratulations to us all who does a good work out there in good and in bad times. And I think that this year, the International Nurses Day report And this webinar has shown beyond all doubt that empowered nurses really saves lives, and the evidence demands really action. Politicians, nursing leaders, everyone, we really demand actions. As you can see on this slide, the roadmap is already here. We have the evidence, we have the tools, and we have been companion for the changes the world nurses needed. First, global WHO global strategic directions for nurses and midwifery. ICN advocates strongly to extend the framework. Now we've been extended to 2030, so 4 more years. Every single WHO member state has committed to actions on nurse education, on jobs, on leadership, on services delivery. We trust we must hold our leaders to account in turning these commitments into real action. Then you can also see ICN's own resources. Charter for Change sets out exactly what it is needed to build the health systems that value, protects, and empower nurses. Our renewed ICN definition of nursing and a nurse. This makes visible the full scope of nursing, rigorous, evidence-based, person-centered care, person-centered, high-impact care. And this year's International Nurses Day report with hard evidence and real-life cases, studies on the 7 powers of nurses. And I really tell you all, just tell stories about what you do, what you think is good for the health of the population, because that's the only way really to make change, by telling the stories. This is our advocacy pact. We are now calling on all national nurses association, nurse leaders, nurse in every role, everywhere, to download these resources, to take the messages from the International Nursing Day report and use them to advocate in your governments, in your organizations, with your politicians at every level. Use them to call on decision makers to invest for impact. Invest for impact means really empowering nurses by ensuring every country has a national nursing workforce plan, and there are resources to actually implement this. Ensuring that every nurse is safe and protected from violence, including in conflicts, investing in the fair pay and decent working conditions that retain nurses and attract new nurses to the profession. Invest in enable nursing with full scope of practice. Invest in nurses as the key to primary, preventive, person-centered care. Transformation. Investing in nurse leadership, because nurses must be at the table where every health decision is made. And remembering that investing in nurses is also means investing in gender equity and health for all. Because, when nurses are valued, supported, and empowered, they can provide better patient care and improve healthcare outcomes. So a big congratulations to us on our International Nurses Day. Together we are strong and we strengthen each other as colleagues. Obrigada, gracias, merci, and thank you.
Sineva, thank you so much for pulling together what it is that we need all nurses and our associations to do to do next. Colleagues, we're drawing to the close of our time together, but before we close out, you've heard a lot about the policy, you've heard a lot about the data as well, but I hope that you've also heard that if we don't communicate these messages clearly and powerfully, then our voice of nursing globally isn't heard. And we are incredibly fortunate at ICN to have a really talented and committed communications department and communications team. They have been working tirelessly over the last few weeks to pull together all of these resources, all of these materials that you see to make these webinars and today's events happen as well, and they are at the heart of the work that ICN does alongside our nursing colleagues. So I'm going to hand over now to one of our team, Pilar Milan, who's just going to take you through for a final time exactly where you can find all of these resources. Pilar, the floor is yours.
Thank you, Howard, and happy IND to everyone on behalf of the communications team at ICN. So on the IND page on our website, you will see the links in the chat. You will find the theme of this year. You will find the explanation of the why it is this theme that we have chosen. Our nurses, our future, empowered nurses save lives. The hashtags that we're using for the campaign. Also, you will see the EMRO e-journal that Mirna and her colleagues have kindly demonstrated to us previously. And you will also see the resources that we have prepared for you, the IND report, the logo, the different brand guidelines. And one of the most important things is these powers that we have been talking about. We've prepared some templates for you to be able to submit your powers, your superpowers as nurses. So we look forward to receiving them at media@icn.ch. On the events page of this webinar for IND, you will find the links on the chat as well. My colleague will put them there. You will find the descriptions of the webinars that have happened today since 4 a.m., also 9 a.m. and 4 p.m. CST time. You will also find post-webinar all of the materials that you have seen on this webinar, including the recordings, and this will happen in the coming days. So I wish you all again a very, very nice IND. And these are the resources that we have prepared for you to be empowered on this IND. Thanks to everyone, and back to you, Howard.
Pilar, thank you so much for sharing where we can find all of those resources. Colleagues, I have a final message for you before we close out for today. I have a message for you all from Florence Nightingale. How do you have a message from Florence Nightingale, Howard? I can hear you thinking and scratching your heads. Let me explain. Last week, I was at the Florence Nightingale Museum in London. If you haven't been, it's opposite Westminster, near to St Thomas's Hospital, a wonderful museum commemorating the life of Florence Nightingale. And there is an actress who gives tours and lectures. I think that she's been in some films as well. She's a wonderful actress who has read extensively about the work and the life of Florence Nightingale. And I asked her a question, and I said, Florence, I said, if you could give advice to nurses that are to come in the future, nurses who in the future, like you, may face resistance, challenges, not being heard or not perhaps being respected, what would your advice be, Florence, to the nurses that have come into the future? And she said this, she said, be persistent and don't take no for an answer, my dear. Be persistent and don't take no for an answer. So I encourage all of you to follow the words of Florence. You got the power. Be persistent. Don't take no for an hour. own your powers, talk about your powers, use your powers, and continue to do fabulous work for the patients that you care for and for your colleagues, and to strengthen the nursing profession. Everybody put your cameras on so that we can all say goodbye to everyone around the world. Enjoy the rest of your day, everyone. Take care. Bye-bye.